My name is Jay Hunter. I'm an emergency room physician at St. Joseph's Regional Medical Center in Lewiston. And I've been in the present position for 34 years. Got my undergraduate degree at the University of Idaho in chemistry, and then my degree in medicine at the University of Washington. So medicine is science-based. Some of it is folklore and things passed on to us from prior generations, much of which changes because it turns out to be incorrect. The main science probably uses biology, physiology, a fair amount of chemistry, pharmacology, mathematics, not so much, basic algebra. So in medical school, I grew up in small town Idaho, thinking I'd probably return as a family physician, but sometimes you find your personality is better suited to other things, and just going through rotations in medical school, type of problems we encountered, I found that the best fit for me was emergency medicine. Actually, our most common injuries, a lot of people picture the emergency room as being trauma and bar fights and car accidents. And unless you're in a trauma center in inner city, that's a small percentage of what we see. Most of what we see are respiratory difficulties, people with emphysema. It's a constant challenge. Constant challenge is to try to not screw up. Because medicine is always an inexact science, and oftentimes you're wrong on initial impressions and diagnoses. Biggest drawback for emergency medicine is probably I have to work an equal number of nights as days. I'm not really a night person, so half my shifts start at 9 o'clock in the night and end at 9 o'clock in the morning. Working holidays, so not just taking call, but actually physically being here. So when my children are young, often I would come to work at 9 o'clock in the morning or Christmas morning and not be home until 10 o'clock at night. I provide the initial treatment, stabilization of injuries and illnesses. And a lot of it is determining how sick people are. So when somebody walks in with pain in their abdomen, is this simple viral infection that we send home? Is it an appendicitis, needs to go to surgery? Is it a life-threatening aneurysm? It is often said that emergency physicians are the experts at taking care of people for the first hour of their illness. Wow. Do I have regrets being an emergency physician? No. No. I feel I was very lucky to have found a profession that suits my personality and has been very rewarding. And even after 34 years of practice, at age 63, I plan to full-time practice until I'm 70, unless I deteriorate mentally or physically. I would, science of course, biology, chemistry, mathematics in high school, but also as a physician you should be a well-rounded person. I would encourage people to pay attention to literature, the arts. Part of being a physician is relating to people, and you could be a very good scientist and very knowledgeable and very poor at your job as a physician if you can't relate to people, have empathy for them. And I think that well-rounded education is very important. I think compassion for people, taking a true interest in the people that come in, keeping interest in the job, continuing education. And medicine is completely different than when I started 36 years ago, or when I entered medical school in 1973. The imaging technologies, the treatments, everything's totally different. So part of medicine is keeping your interest, keeping up, daily reading, study of new things, trying to improve yourself. I was a chemistry major in college because my idea was if I didn't get into medical school, the application I would go to graduate school in chemistry. One of the things we use in the emergency department, portable ultrasound unit, which uses people come in and they're bleeding in pregnancy with the ultrasound to help with our physical diagnosis of abdominal pain, problems in pregnancy, using sometimes a heart transplant idea. We can find veins with the ultrasound to guide our pain in and help that. One of our trauma rooms where we bring people from accidents that are more critically injured. These are all endotracheal tubes that somebody's not breathing, they insert, help them breathe. We've got a video laryngoscope for difficult intubations. These are pretty common. This fits into a guide, and you open people's mouths, you go down, actually see the vocal cord, and then slide the tube into the vocal cords. Everybody's favorite for movies, of course, are defibrillators, so we can pull pads off, shock myself and give you an example.